Hello there, and welcome to my shop. As your CEO, I realize this is a bit unconventional way to reach out to you, but I'm doing this to prove a point. As employees, we all have different interests, and they don't all revolve around work. I like to work in my garage, my workshop, doing wood projects. I enjoy doing wood turning and making rustic furniture. And as employees, I'm sure you have different interests outside of work. The reason I bring this up is because we have recently invested in a new EHR system that I'm hoping will save our organization time and money. We're hoping that you are as invested in this project as we have been. We look forward to having better patient involvement in their care, and this new EHR system offers a wide array of abilities to do so. We'll also be offering a patient portal where patients can look up their lab results, prescription details, any radiology images and reports that they have gotten, and be able to have telephone encounters with their provider if they have small questions, follow-ups on an office visit. And the providers will also be able to reach out and leave messages for the patients. The new EHR system will allow us to better communicate with our patients using social media. We will have a Facebook presence where patients can relay how their visit was and give feedback to other patients, as well as allowing us to see what their feedback is regarding their visit, their wait times, and how they enjoyed their overall experience. We are hoping this new system will save us time and money. If this allows us to have better communication with our patients, especially using the web interface that the portal gives us, we are hoping to cut down on the number of patient phone calls that we need to make. It will be much simpler to simply type out and send emails or messages to the patients. We'll begin this new system integration in a step-by-step approach. We will be going live with our main clinic first, and as we grow more comfortable and see what features this system allows us, we will be adding on new features. Features will include an expansion of the patient portal. Patients will be able to make payments on their accounts remotely. They will not have to stop into the office anymore. We're all human. We all don't like changes. But these changes are necessary in order for this clinic to grow and to provide better health care for our patients. That's rule number one. We always need to be thinking of the patient first. With this new EHR system, we'll be able to have a better social media presence for our patients. We'll be able to offer helpful tips with smoking cessation, how to better control their diabetes through diet, and weight loss techniques. We want to give more empowerment to our patients. A more involved patient is a healthier patient. If they're taking ownership of their own healthy decisions, keeping track of when they're taking medications, and their overall well-being, we hope to see better success in their overall health care. The patient portal is going to be able to give our patients access to their own healthcare records. They'll be able to see their own lab reports, radiology reports, where their BMI stands. We are also hoping this EHR system will allow us better time management. All reports, whether they be laboratory, radiology, or outside reports, will be faxed or scanned directly into the patient's chart for direct access later in the patient's care. This system is also going to allow us to do completely electronic orders for our laboratory and radiology orders. No more paper orders. We're hoping this will also save us time. Ordering system for laboratory and radiology will also be updated with this EHR system. All CPT and ICD-10 codes will be loaded into this system, matching our protocols that our radiologists and laboratories require for us to complete their exams. Because this system is also going to be integrated with our billing, the electronic laboratory orders, radiology orders, and visit details will be automatically sent to our billing department for a faster turnaround time and getting reimbursement from our insurance companies. The new patient portal is also going to give us the ability to remind our patients of their appointments without having to send out or call patients to remind them of their appointments. An automatic email or message will be sent to the patient's smartphone, tablet, or email system reminding them of their appointments. These reports are important because we need to see as a team where we stand in comparison to other healthcare centers. If there's new technology or a new train of thought on how to approach smoking cessation, diabetic, weight loss, we need to be at the forefront of this. This new system is going to give us the ability to see how we compare to these other healthcare centers and see if we need to modify our approach or if there's something we can offer to them to help them to have a better outcome for their patients. Now, back to my original point. I know we all have interests outside of work. And with going with this new EHR system, we should have more time available to us outside of work to enjoy those things that we love doing. No more overtime or bringing work home with us because we were not able to complete it at the clinic. This should make everyone happier and more productive.